again, and welcome to episode 2 of Mentor Moments Growing Beyond Failure. Today, our topic is going to be how do you choose a career in medicine? Medicine as a whole, becoming a physician. How do I figure out what type of doctor I want to be? I'm going to try to go over a lot of different components on how to get there from the college perspective all the way to if you're a medical student trying to choose what residency to do, and sort of everything in between. Again, Dr. Ahan Hunter here. Please go on YouTube, all of the podcast channels, all of the Instagram, all of the socials. Like, comment, share, repost, share with others, all the people's getting started from scratch, and we're going to rock and roll. And we're just going to ride this wave together. And my goal is to help bring about more physicians for more change in where you live or where you want to go and where you want to live. And my goal is just to help you get to the place that you want to be. I want you to become the best you that you can. And hopefully this podcast, this video, this will help you get there as a whole. So, number one, what do you do if you're sort of high school, college, you're trying to figure out medicine as a whole? Is that what I want to do? Is that where I want to go? What do I do if I'm trying to figure out, is medicine the career for me? One advice that I give a lot of people is to figure out what is your personality type. You got to ask yourself a lot of questions. You got to have a lot of personal reflection to figure out who you are, who you want to be, and using different personality quizzes help to bring that out of you, for instance. So I'm a big fan of the Myers-Briggs personality trait quiz, whatever you want to call it. Right now, you can just literally Google personality trait quiz, and then it'll pop up. And there are 16 different personality traits. There are basically 4 different components looking at different aspects of your personality, whether you're introverted, extroverted, et cetera, how your judgment is, your insight, all that jazz. And by doing that, it gives you a 4-letter breakdown of what your personality is. I didn't do it personally myself as a way to figure out just who I am as an individual. I feel like I had a good idea, a good sense of who I am as a person, but I did it more to help me figure out what sort of careers I should be focusing on, what specific things sort of can help bring out the best me that I can be. So I think a lot of it is exposure. So if you aren't around anybody who does something that you want to do, then how do you even know that career exists, right? So this personality quiz is one way to sort of get that started and kind of figure out if what you want to do is what you want to do, right? So by doing that personality quiz will give you a breakdown of what your personality is, but also it'll tell you what careers kind of are more faceted for you. And so, for instance, my personality is ENTJ, and that one is very specific. Hold on, let me bring it up. It stands for extroversion, intuition, thinking, and judging. I don't know all the very specifics of it, but I knew that it had something to do with surgical, especially something using my hands. I am a self-taught drummer. I'm a self-taught beginner pianist and oboe player. So I played a lot of different instruments. I like to use my hands. So I tried to figure out like what careers, what things kind of go with that. And so surgical fields, medicine is what sort of spoke to me and what came out of that, which is very interesting because I took this first. I've taken the quiz probably, 50 times in my lifetime, and I get basically the same thing almost every single time. And I've taken it from high school to when I was a resident. I took it one more time just to kind of see, and I've gotten the same thing every single time. So it's very interesting, just as a whole, to kind of look at that and see. But I strongly suggest, no matter where you are, if you're truly trying to figure out if you want to go into a career in medicine, you want to do a career in fashion, you want to do a career in engineering, whatever that thing is, take a personality quiz because it'll help guide you, get you to open your mind a little bit to other fields and other things you want to do. Next, One big thing that I sort of focus on is once you then figure out an idea of what you want to do, then go to people who are doing that thing to pick their brains to figure out what that thing is, what it really means, what it all entails, and how do you get there. So my one thing that I'm not going to call it a pet peeve, but the one piece that I wish changed in sort of my route from high school to now is I had various advisors that were given to me, advisors that were supposed to, their job was to kind of help me figure out like what college to go to, figure out once I then got to medical school, what career I should choose. And then when I was in med school, then what field I should go into, right? These advisors are supposed to kind of help pick your brain and help you figure out what those things are. Here's the problem. When I was in college, I felt very strongly, and it just like clicked in my brain one day. Why am I asking for advice from someone who has never been to medical school and is not a physician on how to get into med school and how to ace the interview, how to do these things, right? I'm asking people who don't know for sure. They're going off of the students, the folks that came before me, right? And their success. They're looking at what were their numbers, what volunteer programs did they do, what different fields did they want to go into, right? And so you're compiling all that information and then you're trying to regurgitate that and then give that same information back to me. The problem is I may not be the same type of student that that other person that they were used to is or was. So the advice is not going to really work as well for me because it's not personalized, right? You want personalized advice. You want somebody who knows the path, has been there, has blazed that trail, and can help you get to where you want to go, right? So that person is someone I think that you should definitely seek out. And today, in my opinion, it's much easier to seek that person out. For instance, myself, right? I'm a physician. I'm a practicing physician. I was just literally on call last night, delivered a baby. Like I've done all these things, right? I'm doing that every single day of my life. But I also understand what my path showed me and how I got to where I am. So then I can help someone who may have a similar story as mine, right? And I can give them good advice, better advice, I think, than others can because I had to conquer certain things. You know, the first episode we talk about a lot of failures, right? I failed many tests along the way and I had to learn and find ways to conquer that. So to me, finding somebody who speaks to you, who you sort of see yourself in is the goal and what you want to do. And there are a lot of different ways to do it. I am a big advocate for mentoring programs. I feel as though there are not many of them and there should be so many more. And there should be a mentoring program for every single field that's out there, whether it be engineering, like I said, engineering, politics, medicine, all the different things. So I just feel like if there's a mentoring program there, that will help you, give you a better idea of what the field looks like and give you also a better idea of if that field is for you, right? If that thing you want to do is for you and if you can see yourself there. And I think that's the big key point is if you can see yourself doing that thing that this person you want to emulate is doing, then now you have a better idea and a better sense of self that, ooh, I really should be doing this myself, right? So mentoring is huge. Fast forward, you're now you got to med school, right? You got the acceptance. You're now in medical school. You finished first and second year of med school. You're now doing your third year rotations. And those of you who haven't gotten here, we're going to talk more as we go further along in the episodes about, you know, the life of a med student, what it looks like first and second year versus third and fourth year, interviewing, all that jazz. But just 30,000 foot view, You're now in third year of medical school. You're not really sitting in front of sitting at a desk looking at a book, listening to lectures, watching lectures anymore. Now you're in front of somebody, right? You are in the middle of an operation, looking at someone's insides while they're under anesthesia, watching a doctor perform surgery. You are in it to win it. And so now that you're here, I feel as though the hardest part is trying to figure out how you decide to do the thing that you feel as though you want to do. Because before they change, there are these three tests that you have to take when you are getting into medicine, becoming a physician. And those tests are called on the MD side. So there's MD and there's DO. Uh, Allopathic school gives you an MD. Osteopathic school gets you a DO. We'll talk more, and I'll have guests on that help explain a little bit more. Those who are both DOs and MD. I can explain the MD side because I'm an MD, but I'll have someone on the DO side explain that a little bit more. But regardless, becoming a physician, there are certain tests you have to take. On the MD side, there are these three tests called steps, right? There's step 1, step 2, and step 3. Step 1 and step 2 you take while you're a medical student. Step 3 you take while you're a resident. The big factor is that some years ago, I don't remember now, they changed the requirements, the passing for step 1. It used to be a number that was spit out of 200. I think you can get in the 100s, but if you got in the 100s, you might have failed the test. So it's usually 2 something is usually the score. So now they changed it to just pass fail. And so the big factor in all that is that when I was in school, a lot of different specialties used to say that if your step 1 score is X, then that if it's lower, then it eliminates some of the more complex, the harder specialties to get into, right? If it's higher, then now your window of opportunity is much wider. And so you can choose from a lot of other different specialties. My personal opinion is if someone wants you to be that thing, right? Someone in the field is interviewing you and they want you, then the scores don't always matter as much. Now they matter, right? You have to get your foot through the door, but once you're there, the scores are kind of out the window. Who cares what the score was? It's all about, can you practice and be a not only adequate physician, a OBGYN, radiologist, internist, a pediatrician, whatever it may be, but can you be a top-notch physician? And I think that's what a lot of people who are interviewing are looking for. So the big question to ask yourself is, how do I choose what I want to do? And what I like to say is I always tell everybody, go into each rotation. So you go in and you're on rotations where you're in different fields. So internal medicine, OBGYN, general surgery. Sometimes you could do electives like radiology, which are more minutia of rotations. Excuse me. You can do neurology, psychiatry, pediatrics. I feel like I'm missing family medicine. I'm missing a few, but big picture ones. And as you're going on these rotations, go in with an open mind, right? You want to almost go into the rotation thinking to yourself, this may be the one. This may be the rotation that I want to do. And when you get to the end, my advice, and I didn't do this myself, I did this more when I was interviewing for residency, but I felt as though it would have really helped me later, is take notes at the end. What you loved, what you hated, what you can tolerate and would be okay with doing on a daily basis, doesn't bother you as much, but something where you know it may really bother others a little bit more. The big delineating factor a lot of people talk about in medicine when you're on my side of it and they're trying to give advice is, do you want to do something surgical or do you want to do something outpatient, sort of just in the office? The problem is the fields have now changed so much that there's so many nuances to it now, right? So for me, for instance, I not only operate, right? I can do a hysterectomy, I can take out people's fibroids, I can take out a large ovarian cyst using a robot and all these various ways to do all these different procedures in the operating room. But I also work on labor and delivery, and I deliver babies, and I do C-sections. But then I also work in the office, and I see patients, and I talk about birth control, and I talk about heavy bleeding, and I talk about various skin issues that you may have, or weight loss, or menopause, like all these different things. And so my field, what I do, is so nuanced to where I do that, right? It's called a full scope OBGYN, but you don't have to be that. You can just be GYN only, where you don't see any pregnant women. You just see annuals, women who are menopausal, who have osteoporosis, women who are dealing with things like what's called PMDD, premenstrual dysphoric disorder, premenstrual syndrome, PMS, all these different things, but not any pregnant women. You can only deal with pregnant women. You can only work on labor and delivery. Like there's so many avenues, right? So it's like hard to truly figure out that divide of just outpatient or surgery. So what I would say more is, would you rather be in an operating room setting? Not necessarily more often, but does that bring you joy to be there? Or does it make you cringe and you're like, I really don't want to be in the operating room at all? Because I think that then will help delineate you a little bit, because there's so many ways to just like be in the OR and not be in the OR. And it like cancels out a lot of different specialties, especially all the surgical ones, if you don't want to be in the operating room, right? So if you instead, then the next question is, do you want to work primarily in a hospital or in the outpatient setting, or a combination of both? Because even in the primary care specialties, internal medicine, pediatrics, family medicine, sometimes OB/GYN is thrown in there depending on who you ask. But there are part of that specialty where you're only working in the hospital as what they call a hospitalist, or you're more in the outpatient setting. You're sort of in a clinic. You may own your own office or own your own practice, and you're just in a clinic, or you may work for different various groups. And we're going to talk about the difference of those later on, of the setting of being in private practice versus hospital-owned practice versus company-owned, venture capitalist-owned, all these different variations. But needless to say, you got to help figure out in a way, what do you really want in as far as that setting is concerned. And then once you kind of make those decisions, I think it'll help you choose more of what you want to do. Some people go about this very systematically, right? It's all dependent on your personality, right? We talked about the personality quiz before. Your personality will really kind of tell you more of how you should choose. Some people are a little bit choose and make more decisions on emotions a little bit more. And so go on the rotation and then, make notes, but see what sort of brings you more happiness by the end, where you leave it and you miss it a little bit more. Or some are more pragmatic and systematic, where you like to just make tables and pros and cons. And so you look at everything, you weigh it all, and then you see where you fit in all of this. It all depends on making the choice, is really part way about knowing who you are and knowing how you make decisions and make choices. If you are terrible at making decisions, you need very strong people in your corner to help, not only help you make the decision of what you want to do, but help you figure out a way to choose and wean it down to better decisions. So long-winded way of just saying, to sort of piece by piece look at all the nuances of each rotation, each field, and then helps you figure out where you want to go and what you want to do. When it comes to not only when you're in college, but also in residency, who you get advice from matters. Who you choose to keep in your corner to go to when you have questions, that matters a lot. Because you want people not only that you can trust, right? Somebody who's, let's say you're a medical student and you're on a rotation and you feel like you really trust one of the docs that you've been working with. You want a doctor who you feel as though, number one, remember who you are, who will also have your best interests at heart when they give you different advice, but also not bring you down and talk about you when you leave, right? They won't say terrible things and talk about you when you're now gone and talk about you to other medical students, because that's not the right way to go. And you also want people who care, right? Some people don't. When you're here where I am, the motivation for doing what you want to do changes a little bit, and everyone is motivated very differently. Everyone chooses to do things to their own, the beat of their own drum in a way. And so some people aren't motivated to not only teach med students, but also to mentor them. So you really want to find folks, individuals who want to mentor, who want to teach you and teach others and help them learn about themselves and learn about the field as a whole and learn how to get to where they want to go. And it's hard to find that, but when you see it and you've been with folks, then you'll know. You just kind of have this like touchy-feely feeling deep down on the inside when you're with someone like that. And the last piece of this part that I'll say is the other thing is to figure out, where you want to go, right? So you're in college, you've decided that you do want to do medicine. You're trying to figure out, what medical school do I go to? You're in you're in med school, and you're trying to figure out, what residency do I want to go to? I will touch on this more if you guys want me to. So please DM me, leave comments leave comments in the comments about various questions, asking different things. But if you want to know more and want me to go into this part a little bit more in depth, please let me know. I don't mind at all. But the choosing on where to go, 30,000 foot view answer is, in my opinion, it doesn't matter that much. It all depends on what you want to do. It used to be, when I was coming up, we used to say, in the advice that I was getting, just generic advice, they would give like broad strokes advice, that you go to the place, whether it's med school or residency, go to the place that has the field that you want to do. The problem is, if you don't know what you want to do, then how do you know where you want to go? So to me, you just go to places that are accredited. You go to places that have not been on probation within the last 3 to 5 years, and you go places where, when you go and interview, you feel comfortable, because you're devoting a lot of time, energy, effort in these places, whether it's med school or at a residency program. You're giving a lot of yourself to not only these folks, but also to the things around you, to the community at hand. And so you want to feel comfortable wherever you are. You don't want to constantly feel like you're on edge, whether it be uncomfortable with the city, uncomfortable with the politics in the state, uncomfortable with the people in the program or the professors that are there. You just don't want to be uncomfortable, because it creates a lot of uneasiness each day. And so you end up focusing more on how to protect yourself and protect your safety of yourself, instead of focusing more on, how do I become the best physician, doctor that I can be. And so you want to choose places where you see yourself being and staying long term. My big thing is, I grew up in South Carolina. I did medical school in Greenville, South Carolina, and I did residency all the way up in Richmond, Virginia. I didn't know a soul in Greenville before I went there to interview, and I didn't know a soul in Richmond before I went up there to interview. But there was something about the people that spoke to me. I make decisions somewhat pragmatic, but I also really lean into my emotions. I feel like I have a higher EQ, emotional quotient, and that I can read the room. And if I get to a place where I just don't feel like I can be myself, then I don't want to be there. I'm like, I'm not feeling it. And me personally, I dealt with a lot of identity issues growing up, because when I talked about the last episode, identify, for those just listening, as a Black man, right? First and foremost, that is who I am, and was born that way. And I grew up amongst a family that is not in medicine, right? Amongst family that is from the South. And so the way we talk, the way we interact with one another may be different from someone else who may be from like Indiana. I'm just throwing out a random state, but a lot different. And not to say that I wouldn't feel comfortable moving across the country or in the Midwest or someplace else. That's not it. But more, I wanted to be in a place where I felt comfortable, where I could just be my total self, my full self, because I am not reserved at all. I tend to I talk a lot. I tend to talk to a lot of different people, and I like interaction. That's sort of where I draw my energy from, is from interaction. And if I don't feel comfortable enough to give you my true self when I'm interacting with you, then I feel as though I'm being a fraud. And I will take myself out of that situation and not be my full me. And so when I interviewed, I did not hold back on who I was, because I wanted people to choose me because of who I am, not because of what I can represent, if that makes sense. I wanted them to choose me because they like me. I wanted them to choose me because they felt like I would succeed in that place where I was. Now, again, with this identity situation, I guess I can bring it up now. I when I was in college, I found like-minded individuals like myself. I just personally wasn't a big drinker when I got to college. I didn't go to college. I didn't set out for college to try and just say I'm going to be out here on my own. Going to go wild and crazy. I'm going to drink a lot. I'm going to do all these things. It's not my personality. I don't do that. So I found people like myself, and by doing that, I was felt very strongly, and it helped empower me to constantly show people who I am, that I could go to different parties and different situations and scenarios, and I didn't have to drink. I could go to a party and felt like if I felt uncomfortable in that situation, I could walk out and leave, and I had friends who would support me in that. So to me, that's something that you have to find, and it's hard to find when you're interviewing because you don't know anybody, right? You don't know any of these other folks. But once you're there, then you can have a better time finding that. So that's how I was in college. Then when I went to med school, it was a big shocker for me because in my med school class and so I went to a smaller med school. So my class was, I believe, 52. There were two black males and two black females. In the class above me, there was one black male and I believe three black women in that class. And so it's hard sometimes to find yourself. I've been to predominantly white schools my entire life. So that scenario per se didn't bother me as much, but I felt as though when I was growing up that I sometimes had to be someone else and not be who I am. I didn't want to be the angry black man. I didn't want to be the dancer party black man that everyone followed and tried to follow their moves. Like that's not what I wanted to be because I can't dance. My wife would tell you I am awful. Actually, my daughter would tell you I am terrible. I can stay. Y'all seen the movie Hitch? I can stay right here in the pocket. That's me. Just right here in the zone, just here all day long. And if you went to my wedding and you're listening to this and you'd be like, he is lying. It's the truth because that is who I am. Now, do I let myself out sometimes? Of course, I let a little extra out. And people always think that I'm drunk. And I'm like, I'm not drunk. I'm just high off life. I just like to sometimes just have a lot of fun. And I can act a little crazy, but for the most part, like that ain't me. So navigating those spaces as a person of color is something that I really had to learn and hone in for a long time. My mom used to tell me when I was growing up that I not only represented myself, but I represented my family and I represented in a sense, black culture as a whole when I stepped outside of my house. And she didn't tell me that all the time, but she used to say it from time to time. And I used to really rebel against it because I was like, no, I don't. I'm me. I represent me, Ahan Hunter. Moi. That's it. And if someone thinks that black people as a whole act like X because they see me, that's a them problem, not a me problem. But then I realized as I got older that that is actually incorrect. The first time I left the country, I went to South Africa. When I went to South Africa, though I am a black man, when they saw me, they immediately called me American. They didn't call me Black American. They didn't call me African American. I was just American. And what they knew about America, they then came to me asking questions about all of America. And most people only know about New York and California. And I'm telling them, like, first of all, I went to California when I was like 6 months old. So I don't know nothing about it. New York, I only been time in here and there. So I don't really know much about it either. So this thing that I was rebelling against was not quite true because when you do step out the house, you do represent something. You represent so much more. And I feel like as a whole that part of the reason I wanted to do something like this is because I want to show others. I want to show not only other black males, I want to show other people of color. I want to show other folks who may not be of color, like white people, Native Americans, so many other Asian Americans, that like if you see yourself in me, whether you look like me or not, then let me be a representative of how you can get there, right? That's the whole point of all of this. And so once I started to embrace that, I realized that I do represent more. Part of the reason I have scrubs on is because I represent that I'm a physician, right? I'm not just going to be sitting on this podcast with the tattered shirt. I actually went up and brushed my hair. Like I'm not going to look like any old thing when I sit in front of this camera or when I talk to you, even for the listeners out there who can't see the video, the way I speak, the way I'm talking, I'm trying to enunciate. I really want you to hear what I'm saying. So I do represent more than just face value Dr. Ahan Hunter. So all that to be said, I want you to also do the same thing. I want you to represent more. I want you to do more. I want you to decide within yourself that my goal is to be X, either physician, OBGYN, whatever, and go out and do all those things and do more. And again, that's the point of this episode. That's the point of this podcast. I want to support you. I want you to get up and say, you know what, I can do this thing, and you don't need to wait. You don't need to say, oh, I'll do it next week. I'll do it tomorrow. Like, do it now. Like, go ahead. Once you finish listening to this, open up your computer, take that personality quiz, get your friends to do it with you. You guys can compare, what you got. You can look at, oh, mine says I should think about becoming X, Y, and Z. Oh, your friend said maybe da 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 da. And maybe a couple of you together, it may say maybe you all should be physicians. And then, now you may not have to do it on your own. Now you might have others to kind of conquer this hurdle and do it with you. When I see the figures that we talked about last episode, where the number of medical students, applicants, not just accepted, but applicants, is going down year after year after year, that just makes me sad, because there are so many. I think that today's generation, the Gen Z generation, is going to end up being more intelligent, more highly intelligent than my generation and the generations behind me, because you have so many things at your fingertips and in front of you. Your phone is the encyclopedia, where when I was younger, there were people who came to my house and tried to sell us encyclopedias. Like, that's how young the internet was invented when I was younger. Like, I remember life before the internet, and I remember life after, which is crazy to say out loud and to think about, but I remember that. And I remember we bought a slew of encyclopedias, and that was, in that encyclopedia was like the world was at your oyster. You could learn about all kinds of things, what was happening in different parts of the world, where pearls came from, all these random little things, all these random little facts. And now I just Google it. It's just here in my fingertips. Bow, 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 done. And now that AI is here, I personally feel like AI is going to enhance your learning process. It's going to make you more efficient at doing the things you want to do. And I really strongly feel that we need the best, the brightest in the field to advance medicine as a whole. Because if you try to rely on people like myself 20, 30 years from now, we can't work forever. When I'm old and decrepit and can only hear out of one ear, and I'm talking loud because I don't know what I'm saying, I'm starting to talk a little crazy. Like, you don't want me operating on somebody, right? So I feel as though you guys, if you're in the Gen Z generation, if you're not, it's okay. It's fine. You can do great too. You can utilize the same things. But the Gen Zers, or those that come after, are the world is your oysters. Is your oyster? Is that the phrase? I don't know. But is at your fingertips. There you go. And you can do so much. And so I want to empower you. I want you to use this as a way to start to look at various ways to do things that you may think to yourself, I don't want to be a doctor because I don't just want to do X, Y, and Z. Well, you know what? Maybe do a doctor and change the field. Change the way we practice medicine. Change the way we look at certain diseases. Change the way AI interfaces with patients and how you encounter people. Like, you guys can make that change. You can come up with new ways and new ideas to do it. Like, no, it doesn't mean just because you do it, you have to go following the exact same path and do the exact same things that we all are done. I mean, robotic surgery has been around since, I think, the mid 2000s to early 2010s. But before then, there was no robot to operate on people. So, like, someone invented that. So that could be you. So use this as a platform, as a way to dream big, do better, be better, become something great. Thanks again. I really appreciate you all listening. This is Mentor Moments, Growing Beyond Failure with Dr. Ahan Hunter. I truly appreciate every single listener, every person watching, all the follows, all the likes, all the shares, everything. Thank you all so much. And again, to those supporting me, so many people in my corner, thank you guys again. Get ready for episode 3. You're going to love it. It's going to be fantastic.